The dual innervation means that there is a supply of the sympathetic and parasympathetic nervous system by different, to the different organs. So that is called dual innervation. As you can see here, you do not need to memorize any of this. So you can see around the heart, blood vessels, in the lungs are there, and here in the esophagus, here in the abdomen, around the kidneys, around the visceral organs of the gastrointestinal system, in the pelvic area. You see multiple plexuses. So these plexuses are a network of nerves that are both sympathetic and parasympathetic. So this is why these organs need innervation from both sympathetic and parasympathetic to have a normal function to keep the homeostasis. But the sympathetic system also has innervation of the peripheral, in the periphery of some of the visceral tissue in the periphery. The parasympathetic is not there. So this innervation is mainly for the visceral organs. So the balance of the two keeps the homeostasis. So now these slides are really important. This is important for anatomy, for physiology, for NP1, for NP2. If in the clinical practice, this is really important. Also, any patient that have some symptoms or some conditions, majority of those conditions can be explained by this. If you know the background, anatomy and physiology of the autonomic nervous system, a lot of signs and symptoms can be explained by that. So it's very important to know. Side effects of the medication, also another aspect of this. So some medication have autonomic nervous system side effects. So you should be aware that if somebody is suffering from that specific condition, you have to give a different medication so does not cause increase in complications. So look at this slide. So you can see that I put all the sympathetic system here. There is the blood vessels do not have parasympathetic supply. So they are supplied only by the sympathetic system. But based on their type of receptors, that they may contract or they may dilate. So for dilation, you need the beta receptors and also cholinergic, which is responding to acetylcholine. And for constriction is alpha receptors, which again it is responding similar to the beta with adrenaline, but one is causing dilation, the other one is causing constriction. So this is majority of the vessels in the body is like that. So alpha cause constriction, beta cause dilation, cholinergic also cause dilation. There is an exception here, and you can see it in the GI system. So alpha cause dilation and beta cause constriction. For example, if you need more energy, or if you're a fight and flight situation, the digestive function decrease, and instead the blood pressure increase and sends that blood to the vital organs like lungs and heart and the brain, and also that the functions of the skeletal muscle should increase, so more blood goes to the skeletal muscle. So that's why not enough blood is going to the gastrointestinal system. And vice versa, when there's digestion taking place, so the blood is shifted from skeletal muscle and also the blood that is extra blood from the heart and lungs and brain that is not overactive, that goes back to the gastrointestinal system, so they can do digestion and absorption. So the digestion and absorption take place during rest. That's why you do not need too much activity of the vital organs there. So this is why you see the difference between innervation of different organs. Also, you can see that the skeletal muscle and the brain do not have alpha receptors, so they can only dilate if there is increased activity, and they go back to normal. So that is one thing. The other thing is that they also have nitric oxydergic receptors, which is responding to the nitric oxide. So the other tissue do not have that. The effect of the sympathetic nervous system on the skeletal muscle to break down the glycogen, so that will increase glucose, and that will provide more ATP, so that's why increase force of contraction. Also, sympathetic system is affecting the adipose tissue, breaks down the fat, and that provides fatty acid for different organs for the energy. Some other organs are supplied, the functions of the organs are supplied by both sympathetic and parasympathetic. Previous slide was talking about the blood vessels of the visceral organs, but this one is the actual function of the visceral organs. So that's why you can see sympathetic and parasympathetic together. So airways is dilating with a sympathetic function. So when you increase activity, you need more oxygen. That's why it's dilating. And with parasympathetic, when you are resting, you do not need too much oxygen. And the glands are increasing activity with the sympathetic, because when you're breathing more, then there more dust may come into the lungs. So that's why more mucus secretion, it traps all those extra particles, foreign bodies, and maybe germs attached to the mucus, and that way they do not go to the lungs. A salivary gland is increased during parasympathetic, and as you know, parasympathetic is part of the become more active during digestion. So that makes a lot of sense, because salivary gland is important for swallowing, and there's also some digestion take place by saliva. Gastrointestinal sphincters cause dilation in the parasympathetic activity. Sphincters are circular muscles, and they work like gates. So when they dilate, they allow movement of food and nutrients, or feces, or urine. It does not matter, depends on the location, from one area to another area. And when they are closed, it prevents movements of those material from one area to another area. Peristaltic movements are contraction and relaxation of smooth muscles of the gastrointestinal system, and also in the urinary system. That same idea is there, and that increased during parasympathetic activity. So digestion and absorption can take place, and also movement of feces and urine can take place. Gastrointestinal secretion is increased during parasympathetic activity, and that's again because of digestion and absorption. You need a lot of secretions there, the different enzymes for absorption, so that is increased during parasympathetic activity. And when you're doing other activities, when sympathetic system is active, then GI secretions decrease. Liver glycogen breaks down during sympathetic activity, because you need more energy, so more glucose, more ATP. That's why glycogen breaks down. And during the when you eat something, then you are taking more nutrients, so that glycogen storage builds up. So at rest, that builds up because you don't need extra energy, and when you're doing activity, that breaks down. The exocrine secretions of the pancreas is decreased during sympathetic activity, because you don't need digestion, but the enzymes that are coming from the pancreas, they are increased, and that is important for digestion during parasympathetic activity. Lacrimal gland is active during parasympathetic activity. So if this is if somebody's crying, or somebody's, maybe sometimes it can be the crying can be the tear of the joy also is there. So it's not always sadness. It can be sometimes from happiness too. That is for time of rest and relaxation. For example, if an animal is chasing you and a dog is chasing you, you do not want to sit somewhere and then you cry. You just want to run away. But parasympathetic can happen during grieving or sometimes during happiness. When you're not doing a lot of activity, then lacrimal gland is more active. The sweat glands are more active during sympathetic activity because when you're doing more muscle movements and also organs activity increase during sympathetic activity, there is more temperature increase, and for thermoregulation, sweating increase so that you will get rid of extra temperature and the body goes back to normal temperature. Erector pili muscles also cause contraction, so that is getting goosebumps. For example, when you have fear, then you can get goosebumps. Veins are contracting, and that is shifting the blood to the arteries, so that is increasing blood volume. When the blood volume is increased, then more oxygen and nutrients can go to the tissue. Heart activity increase during sympathetic activity, heart rate and contraction forces increase, and also the blood pressure increase, so that is providing more energy and more nutrients to the tissue, and at rest the heart rate and blood pressure decrease. For the pituitary gland, the secretions of ADH, which is causing absorption of the water from the kidneys, increase. That will provide more volume to the blood, and that blood pressure increase, so it means the tissue perfusion also increase. Pancreatic secretions like insulin increase during parasympathetic because you're eating, so more digestion and more glucose increase in the blood, so that's why insulin is needed to take the glucose back to the cell. Pineal gland increase melatonin. This does not normally should not make any sense because melatonin is important for sleeping, but in this case melatonin has a different function. If you remember it from chapter 18, that melatonin also cause as a protective mechanism, so it's an antioxidant. There is a lot of oxygen radicals are made during metabolism, during activities, and melatonin actually fights with that, so to reduce tissue damage. The male reproductive system, it is in your textbook, this is very, very simplified. It is not like that. It's a lot more complicated. Both sympathetic and parasympathetic system are involved in the erection and in the ejaculation, but just for now, because that is just by itself is like a 2-hour lecture, so I don't want to discuss that. But simplify it, the sympathetic activity increase secretions of different glands in the male reproductive system. For example, the seminal vesicle and the prostate gland secretions are increased, and also cause constriction of the internal urethral sphincter. And the parasympathetic is causing contraction of those glands and also urethra, so the semen is coming out, but also the sensory receptors that are around the genitalia, those sensory information are going toward the central nervous system. This is called a visceral sensory, and that is using the parasympathetic pathway. So that's why that is for erection. Another reason for that is that erection, sexual activity take place at rest and then relaxation, not at a time of stress and the time of fear and things like that. So that's another way to explain it, but this is a lot more complicated. So if you have any question, you can ask me later. The female reproductive system, they do not have parasympathetic system. They have two different type of receptors for sympathetic nervous system. One is alpha that can cause contraction, that is during labor, but also during orgasm. And for other times, the beta dominates, and that is for relaxation of uterus.
Thank you for watching this video. Please consider subscribing to the channel. If you like the video, please give it a thumbs up.